A multidisciplinary clinic. His areas of expertise include immunotherapy and the diagnosis and treatments of cancers of the bladder, kidney, prostate, and testicles. Dr. Drake graduated with a BS in electrical engineering and an MS in biomedical engineering at Rutgers University in Piscataway, New Jersey. He then received a PhD in immunology from the National Jewish Center for Immunology, and in 1997 completed an MD at the University of Colorado Health Sciences Center. He conducted an internal medicine residency at Johns Hopkins, and in 2002 he completed a fellowship in oncology also at Johns Hopkins. He joined the Johns Hopkins faculty thereafter. He has published extensively, has won numerous awards and honors for his research and scholarship, and holds 3 patents. He is a diplomat of internal medicine and medical oncology with the American Board of Medical Examiners and a member of the American Association of Immunology, the American Association for Cancer Research, and the American Society of Clinical Oncology. And even more impressively, he has managed to survive and do most of all that while he was married to me. So please welcome my husband, Chuck.
So can anybody, can you see that? Can you see?
Yeah.
Good. How about you over the back? Can you see that? Why don't you come sit on the back over here or something, man? Like, because if you can't see it, it's not going to help, actually. You like sit up on the thing by those guys. They look very happy up there. So that was long, but actually, this is what I really do, okay? So I have a lab, okay? My lab, in the lab, we have mice, okay? And in the mice, we try to figure out why the immune system is not attacking cancer. That's what we do, okay? And we try to change that so it is attacking cancer, right? So that's what I do probably 2/3 of the time. The other, probably 10% of the time, I actually see patients who have cancer. And my goal in seeing patients with cancer is to use their immune system against their cancer. And sometimes we're successful, but most of the time we're not. And I'll show you an example of a successful one, of course, right? And then the other time I teach. So I teach in medical school and graduate school. So that's why I got invited, I guess. This is not a huge class, right? And so you should feel very comfortable, okay? Really, don't think like you're being stupid, whatever. You should feel very comfortable to interrupt. And to facilitate that, I will ask you questions. And I have a personal friend here, my friend Gregory, who I coached in lacrosse back before he was a star. Now he's moved to soccer. So I can start out by asking him questions. But if he doesn't know, he should feel free to call a lifeline, right? So if you have no idea, you can either say, I have no idea, or you can say, oh, let's ask your coach. He's pretty smart, right? Like that, okay? So I really want it to be informal, and frankly, I don't care if I get all the way through to the end. It's more important to get the little parts first, okay? Does that sound fair? Everybody down with that? Again, don't feel afraid to interrupt, okay? You could even interrupt too. And we can say that
First
actually.
time I get that permission.
So anyhow, so you guys are in AP Biology. You're going to take this AP Biology exam, and there will be some questions on immunology, right? Not a ton, but there'll be some questions on immunology. And immunology is really, starts out really hard, right? Because there's so many words you've never heard before, right? All these new words, and that's really the point of this lecture. This is the lecture that we give in the beginning of medical school immunology, before we do all the detailed lectures, actually, just to introduce folks to the concepts and the words. And if you get all the concepts and the words, you'll pass your AP. You get them all right, okay? You should. This is probably a little bit even ahead of where the AP exam is, okay? So anyhow, so you're supposed to have learning objectives, right? Learning objectives are good. So in the beginning, right, you should always know why you should care, right? I mean, you might care about plants, you might not actually, but the immune system you should definitely care about because it's involved in infectious diseases, autoimmunity, I'll show you some examples, cancer, that's my personal interest. And again, the other reason you should pay attention is so you can pass, get a 5, right? 5 on your AP exams, that would be very good, right? You're doubtful, you don't think you're going to get a 5? No? No, come on. A little studying, I think you could do it. So again, we'll start by introducing, if I fall, don't laugh. We'll start by introducing the immune system. The immune system is divided roughly into 2 parts, okay? One is called the innate immune system. The innate immune system is evolutionarily older than the adaptive. So there's the innate and the adaptive, right? Innate is old and stupid, okay? It It's really not very discriminatory, but it's fast, actually. It's really, really fast. Deficiencies in the innate immune system make people really, really sick. Please.
Not everything old is stupid.
So you know it's your birthday. Then we'll transit to talking about the adaptive immune system. The adaptive immune system is much, much smarter. And the adaptive immune system has one property that the innate doesn't, which you should remember. Because it's memory, okay? So the innate immune system doesn't really remember from game to game, from day to day, anything. The adaptive immune system can remember that you had an infection, and then the next time it can respond to it faster, better, stronger, okay? So that's the difference between the two systems. Again, I'll show you exactly what I mean. This is the part that messes everybody up, including the medical students, okay? The immune cells use a whole bunch of chemicals to talk to each other. And immunologists have named them stupid things, okay? I'm not telling you. The names don't make a lot of sense. And I'm not going to tell you all the names, but what I'll do is I'll introduce you to the way the names go, all right? Then finally, this is the best part of the lecture, is the end, right? So the end is like, how does this all work, right? You can tell me all these stupid cells, you know, chemicals, blah, blah, blah. But man, what happens when I get an infection? How does this work? So that's the part at the end we'll talk about, okay? Any questions just as we start? Nothing? You're happy, Gregory? I want you to be very happy. I'm worried about you. So why should you care? So the reason you should care is if you don't have an immune system, you are in deep doo-doo, as George Bush said. So this is, these are lesions that happen in patients who don't have part of their immune system. These are patients who have HIV, also known as AIDS. Does anybody know from your reading or just from your general knowledge what's missing or what's the problem in people with HIV? Well, everybody knows. Ooh, go.
T cells?
Yes, beautiful. So, you know, in graduate school and in medical school, like, success brings, like, more pain, right? So if you get one part right? Somebody always push you another step, right? So you're correct. People with HIV, patients with HIV are missing T cells. Do you know what kind of T cells?
Is it another letter?
Yeah, it's a couple letters. Good.
It's like,
Any lifelines? Anybody want to jump in? No? Yeah, you don't know. So they're missing a CD. Say, don't be shy, man.
Is it helper T cells?
Yes, brilliant, actually. This is why I tell you not to be shy, because you might know, right? Yeah, so they're missing helper T cells. They're also known as CD4 T cells, but they're missing helper T cells. That's because the virus, it's kind of insidious, right? So the virus infects the helper cells, right? And now you can't make help and get rid of the virus. So it's sort of a very devious way to cause a bad infection or a bad reaction. So this is, okay, does anybody know what this is? What are these organs? Yeah, so this is a CT scan, right? And the way a CT scan works, when you look at it, usually the patient's like lying on their back with like their feet towards you, okay? And then you look at slices through the patient. So their back is down here, their stomach is up here, and we chopped off their arms in the picture. So this is the patient's, so now knowing that, what do you think this is? Say it, don't be shy, man. Say it. These are the lungs. Who said it? Come on, be shy. I knew you knew, okay? Don't be shy if you know. So yes, these are the lungs, actually. This is the heart. And these are not normal lungs. They're full of holes, okay? The medical term for holes is cysts, fluid or air-filled spaces. So this is called pneumocystis carinii. It's an infection that you might have, actually. You might have pneumocystis. Actually, I bet you there's probably about a 50-50 chance you have some pneumocystis parasites in your lungs right now. But why are they not hurting you? Yes, because you got a good immune system. You're kicking butt, right? It's working now, right? If you had HIV, they might stop working, and then they cause a rampant infection called pneumocystis carinii. What does that look like? Does anybody know what that looks like? Who said that? Say that, man. You think you're not going to get a 5? Say it, man.
It looks like herpes.
You're correct, actually. This is, so you're absolutely correct. So when this was first seen, anybody saw the film Tom Hanks' Philadelphia? No, it's an old film, an old guy, right? I'm too old. So basically, he developed HIV, and the first way that he was a lawyer, and the first way that people knew where he worked was he came in with these like lesions that looked like herpes, actually. And at first, though, they didn't think this was herpes. They thought it was cancer. They thought it was sarcoma, right? It turns out it's not. It's caused by human herpes virus 8, okay? And what it is it's Kaposi's sarcoma, And again, it only happens in people with HIV. Okay, so yes, you're right, it was herpes. Okay, and again, it only happens if you have HIV. This is a baby who was born without part of his immune system. It's a bubble baby that they have no ability to resist infections. They're missing an enzyme, so they don't have T cells. Yeah, very good. Okay, so again, if you don't have an immune system, you are in trouble. The other thing that's important about the immune system is the immune system has cured the world of some diseases. Okay, this disease. Anybody know what this disease is? Yeah, because the guy has pox, and they're not very large, right? Yeah, I'm serious. That's where it got names. These small pox. This is a disseminated case of smallpox. Fatality used to range between 15 and maybe 50% of people who got this would die. A vaccine was developed against it, promulgated to the entire world, and in 1979, vaccination officially eliminated smallpox. What part of the immune system does vaccination use to prevent diseases from coming back? Does anybody remember from the beginning?
We'll use the adaptive.
The adaptive part, brilliant. Okay, correct. So it's the adaptive immune system. And what feature of the adaptive immune system?
Memory cells.
Memory, right. So memory. So the vaccine is designed to help you remember different infections. Okay? So that's vaccination, an example of memory. This is what I do. I couldn't help but sticking it in here. This is a patient in my clinic who had kidney cancer and who was dying. He had given up hope. He had been treated with all these drugs, like 4 different drugs, and none of them really worked. And he had given up. He lived in Washington, D.C. This is another CT scan, right? So here's his spine, right? Here's his good kidney. Humans generally tend to be symmetrical, right? Left half to right half, pretty similar. So you don't have to be a radiologist to see that. This is a nice looking sweet kidney. This is probably not, okay? This is in fact his cancer. And you didn't even have to be a good doctor. Gregory told me in the morning he wants to be a doctor, right? So one thing as a doctor, you want to feel stuff, right? So take a look. What do you think you might feel if you're pushing, Gregory, if you're pushing on this guy's belly, what do you think you might feel?
Like a lump.
Absolutely. This guy had a protruding mass from his kidney cancer growing through the ribs and outwards, okay? So he had given up, but he heard about this clinical trial that we had at Johns Hopkins of a way to activate the immune system against cancer. So he started on this drug. He didn't have any side effects. And 6 months after being treated, he was treated for 6 months at first, and this giant cancer mass shrunk down to that. Kind of amazing, actually. He stayed on the drug for about 2 years, and it's a clinical trial. It's not an FDA-approved drug. And then he stopped. So who should we bother? What do you think would happen when we stopped? Did the immune system keep fighting the cancer, or did the cancer start to win? What do you think?
I think the immune system would take over.
The immune system kept fighting his cancer. I actually saw that dude yesterday in my clinic. And he hasn't been treated for 7 months, and his cancer is even smaller than it was before. And we got what's called a PET scan. So a PET scan shows parts of your body that are eating sugar. So it shows sugar metabolism. So this is when he first started. This is the cancer. It's flaming, eating sugar. And this is about 2 or 3 months ago, and it's just simply gone. So basically, he's in a PET complete remission, and hopefully he'll stay that way. And this is his first CT scan. I don't know what happened there. Okay? So the immune system is pretty good, right? Right? Everybody like the immune system? Now this is a good thing for taking. So is the immune system always? Remember that word, always good.
No.
Who says yes? Who says no? We'll have a vote. Who says yes? It's always good. Who says it's not always good? Yeah. When you have an exam, right, and it says always, it's almost always bad choice. No, it's not always good. It can cause diseases called autoimmune disease. Okay. This is an autoimmune disease in your brain. Okay. This makes, it particularly affects women. It makes them progressively weak. Anybody know what that's called? Or maybe you know somebody who has it. Any guesses? Who said it? Don't be so shy, man. Nobody thinks you're stupid. Who said it?
You're saying lupus.
Who said it?
Lupus, is that correct?
Sorry?
Lupus?
No, well, actually, it's a good point. So lupus is an autoimmune disease. That's actually brilliant. It can affect the brain, but it's usually, so that's a great answer. There is central nervous system lupus. Absolutely great answer. The difference is central nervous system lupus is not so like patchy like this, right? So that's a great answer.
Me. Oh, is it MS?
Really good, actually. Absolutely brilliant. So it's
Oh, I did a
multiple.
project on it.
So do you know what it stands for?
Multiple sclerosis.
Yeah, so this is a picture of a person with multiple sclerosis, and it's the immune system attacking the insulation around nerves. It's attacking the myelin sheath around nerves. Brilliant. Huh? So it's actually fascinating. So this person has these big lesions, right? Okay, we're gonna bug MS person here a little bit.
Okay.
So do you think with these big lesions they're sick or they're not sick?
They're sick.
Interestingly, surprisingly, it's not, right? So what turns out is when MRI was first discovered, they started taking pictures of the brains of mostly women with multiple sclerosis. And it turns out this is like healing, actually. So the images look worse when the patients are actually getting better.
Is that
surprisingly.
because the cells are regrowing with the cells?
Absolutely. So they're regrowing and rebuilding. Perfect, actually. So this is an autoimmune disease called multiple sclerosis where the brain is attacked by your immune system. How about this one? Anybody know what this one's called? We got your code. What do you think?
It's having arthritis, isn't it?
Yeah, so what does arthritis mean? This is, remember, I started at the very beginning. The class is about words. So itis. What does itis mean?
Swelling up.
Yeah, so itis is inflammation, right? And in the Latin, inflammation, this is actually probably going to be on your AP exam, by the way. So what are the 4 characteristics of inflammation? This is good to know.
Like swelling, pain, I don't know, redness.
Oh, you got 3. Yeah, you got 3 actually. So I actually know. So in the Latin, right? So rubor, right? Redness. Calor, what is calor? Hotness, right? Okay, so rubor, calor, dolor, pain, and tumor, right? Rubor, calor, dolor, tumor. That's actually a very good thing to remember, medical boy. You got that? Got it down, right? Rubor, calor, dolor, tumor, right? This is good. So itis is inflammation, right? And this is when you want to be a doctor. You can sound really smart and know nothing, right? Honestly. So artho means related to joints. So arthritis is inflammation in the joints. That's all it means. What do you think inflammation in the muscles might be called? Anybody have a guess for that? Anybody know the prefix for muscle? So who said it? Say it. Don't be shy. Myositis. Yeah, I heard it. Myositis, inflammation in the muscle. Inflammation in your bronchi. Everybody suffers from this. This is called bronchitis. Okay, now you can all be doctors because you can make up inflammations, right? Okay, it's easy, right? Inflammation on your skin. Oh, we all suffer from this occasionally. Dermatitis. Get it? This is how it works. Okay. Inflammation of the skin. Okay, so that's why you should care about the immune system. So anybody still not care, you probably shouldn't say something. So now we all care about the immune system. Now we're going to learn a little bit about how it works, okay? You ever watch these old football games where the guys like run really, really fast?
Yeah.
Right? And it's like, looks like it's a fast motion, like this. This is how I think of the innate immune system. So they're kind of stupid, right? They're kind of stupid, but they're really, really fast, okay? They don't have a particular plan, but they just move, they react, right? As a matter of fact, the plays were much simpler than that. It's very simpler, it's more reaction. These are the first cells from the innate immune system, and playing the name game, yeah, okay? Neutrophils. Neutrophils. What the heck does that mean? So who should we get? Who haven't we got? So what do you think? So if you like look down, that's the sign we should always get you, right? So what do you think? Phil. How about Phil? The Latin Phil. What is Phil? Philosophy.
Can I call it like one?
Yes, call it. Professor.
Who wants to? Anyone take Latin?
Latin. What is Phil in Latin?
You take.
Yes, we got a volunteer.
Like if someone's like, I feel like it has an affinity for water.
Yes, to like, right, to have an affinity for, to like, to love, in fact. So Phil is to like, right? Neutro is just like neutral, right? So these cells got their name because they love, or like, or have an affinity for. I like the affinity for, that's actually better probably. They like neutral dye. That's all that means, okay? Neutrophils, cells that love neutral dye. You guys are in some kind of biology class, right? And so most cells have this thing in the middle where the DNA is. It's called the what? So, like, what's up with that? What do you think that is? Say it. Say it. What do you think this is? This purpley thing there. This is actually, in fact, this is the nucleus. So what is the nucleus? It's broken down into segments, 5 different segments, okay? On a microscope slide, you can always tell a neutrophil because it's got what's called a hyper-segmented nucleus, okay? These cells are the shock troops of the immune system. When you look in your blood, anybody ever go to the doctor and you're sick, they take your blood count, and they do your white blood count, cell count, right? When you look at the white blood cell count, the most common cell in the white blood cell count is in fact neutrophils. You need a lot of these, okay? These are the most important ones at fighting infection. If you have a deficiency of neutrophils, you're actually sicker than if you have HIV. You mostly don't make it till adult infection. You really, really need these cells, okay? They live in the blood, but they respond by going out towards infection. So they got to get from the blood, right, from the blood vessels, out into the tissues. Is that easy or hard?
Hard.
Hard, right? So how do you think you would get, right, from the blood into the tissues? Any ideas? Anybody else? Idea how to get the blood into the tissues? So you guys did circulation yet? Yeah. No. So the blood vessels are lined with these cells called endothelial cells, right? They're pretty close together, so your blood doesn't leak out into your tissues, right? So what these cells got to do is they got to make their way between those other cells, right? If you were squeezing through there, what do you think would happen to a big juicy nucleus? It would burst, right? So the reason for this hypersegmented nucleus is so they can squeeze between the cells of the blood vessels and get out into the tissues. Have you ever seen a neutrophil? No? Seen a neutrophil? Anybody? Anybody ever have a whitehead? You know, like a pimple, you know, the white stuff? Yeah, so what do you think that white stuff is? Some people call it pus, right? But that's neutrophils, okay? So basically, a collection of neutrophils is pus. In the old days, physicians loved pus so much, they divided it into like 5 different kinds. So there was like the bad kind, the medium bad kind, and then there was one kind that was really good. They loved it so much, they thought it was laudable pus, beautiful white pus, which was filled with neutrophils, and what this meant that the patient would what? Yeah, they would get better, right? So if you had a big wound in your arm and it turns beautiful white pus, that's a good thing.
Oh, so I just have a quick question about something you said before. So you said
Sure.
neutrophils have an affinity for neutral what? Dye?
Dye, yeah. So this is when you
Like,
stain them
why
under the
dye?
microscope.
Oh, okay.
Yeah, exactly. This is how you can just tell who's who by staining them under a microscope. Yeah, thanks for asking that question. And again, feel comfortable to ask questions. So again, neutrophils, most common cell in the blood. About 60% of your white blood cells are neutrophils. It's a lot, right? The rest are T cells and some other kinds of cells. But most of them are neutrophils, actually. Any questions on neutrophils? We all love neutrophils. Oh, so neutrophils are cool, actually. So they live in the blood only about 6 hours, right? They're really short-lived guys. Again, they're like the shock troops, the cannon fodder, right? When they get into the tissue, then they can live for a long time. When they're in the tissue, what they're doing is they release these granules that leads to toxicity of bacteria. Not really viruses, more for bacteria. And so basically that's what they do. So they live in your blood. When there's an infection, they leave the blood, they go into the tissues, they release toxic granules and help you to kill bacteria and fungi, things like that. Okay? So do we like neutrophils? Neutrophils are pretty cool. All right. Next cell that's important. Questions, please?
Oh, I was gonna, my mom's a nurse.
Yeah.
So whenever there's pus in a wound, does that just signal that there is an infection or that your body is fighting the infection?
Really good question, actually. So the presence of neutrophils indicates acute inflammation. That's the way to say it. And what it means is what you just said. It means your body is fighting the infection. Exactly. Okay? So neutrophils, acute inflammation, and inflammation, Gruber, Cowler, Dohler, Tumor. This you should learn, trust me. Okay? Good. Good, great question. And again, feel free to interrupt. All right, this is another cell type. And you can see it's actually like vacuuming. These are bacteria, right? And this is this cell. And it's like vacuuming them up. I mean, literally, this is what it does. It vacuums them and eats them up, okay? It has a name. There's its name, okay? So it gets its name from 2 Latin words, okay? Macro, I hope we all know. What is macro?
Big.
Good. Phage. What is phage? To chew, like eat, right? So these are big eaters, okay? Macrophages, big eaters, okay? Macrophages are, macrophages are different than the neutrophils. They live in a different place. The macrophages live in the tissues. So again, two ways to fight infection. One is with some cells in the blood, right? One is with some cells in the tissues. So it's pretty smart, right? You were designing an immune system. You want to have two ways to fight it. One right there in the tissue with the macrophages, right? And one in the blood to sort of help them out. So again, these are big eaters. Another question, have you ever seen a macrophage? Don't think so, huh? Maybe you have, actually. So when you get a tattoo, what happens is the dye is a foreign substance. It's initially taken up by macrophages. Later on, it gets transferred to other cell types, but you probably have seen some macrophages in the form of a fresh tattoo. They turn black because they take up the dye, actually. So yes, you probably have seen some. Anybody have? Yeah, they don't. I asked it in med school, and they were like, "Oh, look this." Okay, so those are the two most important cells in the innate immune system. They move fast, they kill, they eat, they get rid of infections. There's another cell that might be your friend and might not be your friend. If you lived in India, it would probably be your friend. If you live in America, it's not quite so much your friend, okay? This cell is called the mast cell. So mast. Mast cell. So see the cell here? Just imagine it's 1878, right? And you're the first person in the world with a microscope. And you're slicing up everything. You're slicing up people, mice, rabbits, taking slides, you look under the microscope, and you find this brand new cell. And check it out, it's full of these black things, and it's sort of at the junction of blood vessels, right? Okay? So this is really what happened. It was Paul Ehrlich discovered this cell, and he said, man, what does this cell look like it's doing? What does that cell look like it's doing to you? What do you think? What is all this black stuff, right? Any other ideas? If you saw this, you would say, that cell had just done something. Yes? Anything? What he thought was that this cell had just eaten all this stuff, right? He thought it was a cell that was eating, sort of like a macrophage. And he thought these were black blobs of stuff that the cell had eaten. So mast comes from masticate, like to chew. Like this, masticate, right? So he named them in the German Mastzellen, eating cells, right? Okay, that's where it got its name, mast cells, eating cells. Are scientists always right? No. So this was completely wrong, actually. These were not cells that had eaten stuff. Completely wrong, okay? These are cells that contain a chemical that can make you sick and even kill you. It's called histamine. Anybody ever heard of histamine? Yeah, anybody ever take Benadryl, or Claritin, or Allegra? Those are antihistamines, right? So these cells are landmines. They're loaded with histamine, right? On their surface is structures that sense an allergen or something that causes an allergen. In a way, like I said, they're like landmines. So what happens, they just sit there in your body and they're waiting for you to see a peanut, for example, if you're peanut allergic, right? When they see their whatever they're designed to sense, they boom, they burst, they release all this histamine, and what happens to you? Ooh, everybody's say it?
Anaphylaxis.
Yes, anaphylaxis, man. You could have so much histamine, your blood vessels dilate, and you could die, actually. What if you have just a little couple mast cells in your nose? Right? And you sniff something. Oh, man. What happened next, actually? Sneeze, right? So if you have inflammation in your nose is rind, like a rhinoceros, right? Itis inflammation. So inflammation in the nose is rhinitis. So mast cells in your nose would just give you a little rhinitis. What if they were in your sinuses? Sinusitis. You guys are getting the idea, right? What if they were in your skin? Dermatitis, right? So anyhow, the point is that the consequences of mast cell release of histamine depend on where the mast cells are, okay? What if they were in your gut? What do you think would happen if they were in your gut? Say it. Yeah, don't be shy. You probably get diarrhea, actually. That's what I thought you said. So yes, you could have colitis, inflammation of the colon. You're getting the idea, right? So they're a little bit like landmines. Is that a good thing? You were designing an immune system, and you designed this stuff to make everybody sick. Would you do that? Would you do that? I mean, if you're God and designing this immune system, would this be your idea? So why do you think God designed these cells? What do you think?
It's for the immune system to protect against outside.
Against what? Exactly right. So we talked about the neutrophils and the macrophages being good for bacteria. What do you think these cells were designed to fight? Any guesses?
Maybe things that like the body senses as poisonous or toxic.
You're on the right track, man. Keep going. So imagine, I'll give you a little hint. They're very important in third world countries. Say it. Everybody's so shy. Say it.
Parasites?
Brilliant. Absolutely brilliant. So they were designed to fight parasites. And these granules, these histamine granules, are very toxic to like worms and filaria.
You mean they evolved?
Whatever. Whatever, please. So anyhow, so these are cells that are supposed to fight parasites. So in a developed country, they generally don't help you; they hurt you. But if you lived in a place where there's more parasites, you would need these to help fight the parasites. They release these granules are full of many other evil things. Actually, they dissolve tissue. They have proteases. That's why you get scarring when you have bad inflammation. It's complicated, but it's kind of neat actually. And again, I'd like to think of them as landmines. Okay? So that's some cells from the innate immune system. So now we're going to move. So any other questions about the innate immune system? We talked about macrophages, neutrophils, and mast cells. Any questions about innate? No? You guys are happy? You're happy? Feel pretty happy? Okay, it's a little early, but you're happy. Now we're going to talk about some of the new players actually in the adaptive immune system. All right, so help me out. Who's this guy? Yes, thank you. So he's a young rookie starter, right? So we're talking about some young guys. Again, these guys are more adaptive. They know they're smarter. He's actually not so fast, really, right? He's smart, right? Okay. But he runs pretty well, right? So these are the cells that are my personal favorite because these are the ones that we think can kill tumor cells. They also can kill viral cells. These are called T cells. You've been hiding behind the camera, man, so I haven't got you one single time. So why do you think they're called T cells? Because T cells. I mean, do they have little T's on them? Like, because right here in this picture, if you think, like, if you look under a microscope, maybe they have a T on them or something, so you can tell who they are.
They mature in the thymus, that's why they're called T
Yeah,
cells.
actually, right. So where's the thymus?
Not sure.
So when I was dating your teacher, I came over her house one time, and this was early we were dating. I was sitting around the table with her and her mother and father, right? And we were like just talking and stuff. And every once in a while, one of them, usually her mother or father, would go. And I was like, okay. And they'd be talking, and they go, like, okay. I'm like, maybe we should leave now, you know.
Oh,
and after a while, I said, it is a true story. After I said to her father, I'm like, you know, no offense, but like, what are you doing? He goes, I'm thumping my thymus. And I'm like, well, why are you thumping your thymus? He goes, well, that's because that's where the T cells come from. And if you thump your thymus, you'll release them and you'll have a better immune system. Probably not true, but that is where they come from. They come from the thymus. The thymus is an organ. It's right underneath your sternum. You guys still have a reasonable thymus, but it's starting to go away. As you get older, the thymus involutes, actually. But that's where they come from. These are T cells that kill. These are my favorite cells in the immune system, my personal favorite, because they can kill everything, okay? They can kill tumor cells. They evolved to kill virus-infected cells, and they kill them by recognizing and using these two molecules. The way they kill them is actually quite brilliant. So one way is they punch holes in their targets, and the cells just sort of explode. But the other thing is even more clever, is they whisper to them. They send molecules through to the target cell, telling it to kill itself. Okay? They induce suicide. Yes, they That's how they kill them, actually. And what's really even cooler is they kill and then they move on. They're serial killers. So there's this beautiful microscopy videos, which I couldn't download properly, but there's pictures. They have a field of cells, right? And the CD8 comes in, boom, kills somebody. Are you the right guy? No. Are you the right guy? No. Are you the right guy? Ah, you're the right guy. Boom, kills him. Go, go, go. So it tells the right guy by this molecule. This molecule is called the T cell receptor, and it's really, really specific. It's only specific for one particular peptide or protein. So it goes, are you the right guy? Yes, boom, kill. In cancer, we want this to be a cancer protein. Usually it's a viral protein. So if you have a virus infection in your lungs, right, and you want to get rid of it, what your body does, or what your immune system does, is sends in the CD8 T cells, and it kills the virally infected cells. Now you might like those cells. They're like your lung cells, right? It doesn't care. It kills them. That's why you get a cough. That's why you cough stuff up, okay? So again, serial killers, CD8s. These are cells that can have memory too, actually. And I'll show you what memory looks like a little bit later on. So everybody cool with CD8 T cells? Okay, good. The other T cell that we were introduced to earlier were the ones that are missing in HIV, which you guys picked out for us. These are CD4 T cells. These are helpers, okay? It turns out that the CD8 cells kind of need a little help to be really good killers, okay? They need help from CD4 cells. Also, the other part of the immune system is to make antibodies, and that's what they do. So CD4 cells help CD8s to kill, and they help another cell called a B cell to make antibodies. CD4 helper. If you just say that, you're good. Okay? Everybody, CD4 helper. Okay? They also recognize small proteins. How many different kinds of CD4? Let's start with the easy question. Drugs. Okay, you like drugs? You know, drugs or not? But drugs. How many different drugs do you think drug companies have in their libraries, in their freezers, in their cabinets and stuff? 10, 20, 100,000, 50? What do you think?
100,000. No, like probably 100 something.
You're correct, actually. So drug companies probably have about between 100 and 200,000 drugs in their screening libraries. That's perfect, actually. How many different T cells can you personally make? You'll be surprised.
What's that?
1 times 10 to the 15th. Okay? 1,000 billion. Okay? So you in your body can recognize, can build more different T cells than all the drugs in all the libraries of all the drug companies in the entire world. Just you. Okay? So the immune system can recognize many different things, actually. Better than drugs in some cases. Okay? This is an antibody. Anybody ever heard of an antibody? Yeah? What do you know about antibodies? Tell us what you got.
They're like they are made to recognize specific like invasive cells.
Absolutely. So so antibodies are small molecules. They look like this. They're like Ys. Okay, like Ys. And what they do is they're cells that are they're proteins that are part of their immune system. They're made by B cells. I'll show you B cell in a second. And these are part of like sort of the working part of the immune system. This is the part that binds to its target. What an antibody recognizes, this gets where it gets complicated, okay? An antibody recognizes an antigen. Okay, can you say that? An antibody recognizes an antigen. So an antigen is just the part that it recognizes. It can be a bacterial antigen, right? That's a good thing. It can be a viral antigen, right? But somebody talked about, diseases before. It might also be an antigen from what?
Yourself.
Yourself. It could be also a self-antigen. And in multiple sclerosis, they recognize antigens in your nerves. Also in your back.
That's because it crosses the brain-blood barrier.
Yeah, so these are little soluble proteins. It looks big in this picture, but they're not. They're really tiny compared to the other cells, right? And they can cross the blood-brain barrier. They can get into tissues, and they recognize their targets, their target antigens. These are also very specific. You can also make about 1 billion or so different antibodies, okay, depending on what you're exposed to. And these are very important parts of the immune system. Each antibody actually turns out has 2 binding arms, right? So it's like this, here and here. And that's important when you want to like sort of coat up a bacteria or something like that. So this is the part that binds the antigen, this is the structure, and this is the part called the FC region. But don't worry too much about that. Just know that there's proteins called antibodies. So, Gregory, my friend, what is the purpose of most vaccines? Have you had a vaccination? I don't know if you should, but have you had a vaccination lately?
Not lately.
Not lately. What's the last vaccination you remember?
Last year.
What'd you get, man?
It was the flu vaccination.
You got the flu. Brilliant. So what is the purpose, my young friend, of a flu vaccine? Why did you get that?
To prevent the
And how does it work? What is the goal, the immunological goal of a flu vaccine?
Does it insert antibodies? antibodies.
It's designed to make your body make antibodies against flu proteins, and so you'll have memory, right? So when that flu comes into you, you can respond quickly, right? So yes, you are particularly treated to make antibodies against the flu. How many different antigens or different proteins do you think was in that flu vaccine? One? It's like they asked the flu.
No,
Yeah, a couple actually. So the flu vaccine has about 9 different antigens actually. How about anybody get vaccinated against pneumonia? Oh, sorry, go ahead.
I have a question. So, like the flu, it's like there's different strains, and they have to pick like the strain that they think is going to be most common.
Yes,
So
exactly.
Do they have to? Even if they pick the strain they think is going to be the most common, do they only consider a few strain or antigens?
Yeah, so what they do, they try to predict every year what flu strains are going to be the most common, and then they formulate a vaccine that has the proteins or the antigens in that flu vaccine. So it's only for a couple, about 9 different proteins actually. Good. Any other vaccines that you guys had that you liked? What vaccine?
Actually, I have really bad news. So the bell's about to ring, at which point we have to do the announcements.
Okay.
And then we take attendance and watch the announcements, and then if you want to continue.
Yeah, we got to continue rolling. That's not fun, okay. Oh, we didn't get to the B cell. Okay, we do the B cells the thing? Right, so these are B cells. B cells come from your B. What's B? Well, yeah, this guy here was like hiding behind the camera, and he like, womped up with the T. So since you're so good on the T for thymus, where does B cells come from?
Yeah, bone marrow.
They actually do. So they originally come from the bone marrow. It's a good way to remember it. B cells are the cells that make antibodies. Okay, that's all you need to remember. Okay, they're the cells that make antibodies. So I think of them as antibody shooters. Okay.
Good. I'm sorry, I forgot to put it up.
Oh yeah, put the TV on. Watch that.
Kind of.